December is Cervical Cancer Awareness Month, sometimes known as the Silent Cancer. Michelle Beaver is the Executive Director of the South Heartland District Health Department. Susan Ferrone is Public Health Nurse. Thank you, ladies, for joining us to talk about what really is a very important subject. They do call it the silent cancer. Why is that, Michelle?
Thank you. Thank you for having us here. We are celebrating or promoting cervical cancer awareness this month because not only is it an important cancer and it's a silent cancer, but also because South Heartland is promoting cancer prevention in general, along with our community health improvement plan. It's one of our 5 priorities for community health improvement. And so we're interested in promoting this, and it turns out that about 12,000 people will probably be diagnosed with cervical cancer in 2013. And there'll be probably 4,000 of those that will die from cervical cancer.
Wow.
So it's an important cancer, and also about 1 in 10,000 in our area will be diagnosed with cervical cancer.
Yeah, scary stuff. Of course, like with all cancers, catching it early is really a key, isn't it, Susan?
Right. You mentioned silent. It's something that's not detectable until maybe a little later on in the stage, and where it's a little bit more lethal. And so, because symptomatically you don't necessarily see those symptoms or detect it personally. So really what we're recommending is that women at their yearly annual exam talk to their doctors about pap smears. That's one of the leading ways that we can detect that. And there might be some different intervals in screening. And again, talking with your healthcare provider is going to be your best bet.
And you talk about that communication because it is so key. I mean, this is a situation people are sometimes not sure what to ask. Some other things you talk about, making sure you get the pap smear. Are there other things that should be asked?
Right. Well, when you sit down and talk with your healthcare provider, you're going to ask certainly, first of all, what is a pap smear? It's kind of funny that some people don't even know and need to have that discussion with their provider. Not only what is the pap smear, but what also can I do to lower my risk factors? And those are different for different people. So that's going to be a very individualized conversation with your provider. Also, what's really important to ask is, what about the HPV vaccination? You've heard maybe some of that in the news. The recommendations are basically middle schoolers through age 26. But again, talking with your healthcare provider and getting the best information from them based on your risk factors is again your best bet.
And you guys give some places to go, www.cancer.org, or you can also go to the South Heartland District call you guys at 402-462-6211, or the website is southheartlandhealth.org. Michelle Beaver, Susan Ferrone, thanks for joining us this morning. Happy holidays to you.
Thank
Stay
you.
with us. We're back with more News 5 at 11:30 right after this.